Ed. Welcome back to another episode of Voices of Innovation Payer Edition. Meet the authors. And today I've got two amazing authors, Anna and Don. Anna and Don, welcome to this.
Thank you. Glad to be here.
So the first thing I want to do is just have you each introduce yourself, because our audience will want to know who wrote this chapter, and it's amazing, and get to know sort of the person behind the writing. So Anna, why don't we start with you? Tell us a little bit about yourself and maybe a little bit about your company.
All right, my name's Anna Pannier. I'm a vice president of IT at a company called Centauri Health Solutions. I've been in healthcare about 30 years, and I started my career in the health plan side originally, but then spent most of my time on the provider side. And so at Centauri, I've been able to bring them all together again with both the provider and the health plan together. And Centauri, that's what we do. We're a tech-enabled services company, and we help. Basically, we look for those complicated problems in healthcare and in the ecosystem, and try to help solve those on behalf of our clients and our members.
Yeah, that's what I love about your background, both on the payer side and the provider side. And you've been a contributor to Voices of Innovation previously. So thank you for that as well. Don, tell us about yourself.
Yes. Again, thank you for having us today. I am also at Centauri Health Solution with Anna. Privileged to have her as one of my colleagues, and on the same team here at Centauri, developing these great solutions that are tech-enabled that help our clients solve some of the most difficult healthcare problems. My particular role is the Director of Product Strategy here, although I do many things related to regulatory compliance, risk adjustment, social determinants of health, various things. And I too have it's been almost 30 years for me in the healthcare space, doing a little bit of everything, focused mostly on revenue cycle, but also payer and hospital operations and finance and applications development. And I bring all of that to bear here for our clients at Centauri.
Yeah, that's amazing. And Don, tell us a little bit about, and certainly Anna, you can jump in whenever as well, but tell us a little bit about the chapter that you wrote.
Sure. So our essay is titled Closing Gaps in Healthcare is a High-Tech, High-Touch Endeavor. And what we tried to do here is illustrate the very critical need to address deficiencies in healthcare delivery. And again, both Anna and I are very involved in that here at Centauri, especially related to vulnerable patients. And so this chapter will emphasize the role of a comprehensive support system, clear communication, follow-up, everything to ensure patient well-being across the entire span. And so what we hope to do in this essay was to highlight the potential of partnerships. So this is all about partnerships and not silos between health plans, hospitals, people, and technology to address all these complex needs across this span. And so we specifically focus on the incorporation of technology, particularly the use of a tech-enabled care coordinator. You saw a little bit about that role in the essay, to bridge the gaps in post-discharge care and improving patient outcomes.
Yeah, anything to add, Anna?
Well, I just love that we talk so much about the promise of technology, but then it always falls short. I mean, how many years have we still been trying to solve the same problems? And so what I love about this is we're doing some real, true examples in the work we do, where that sharing of data is critical, which we've all been working very hard on. But it does take that extra manual step and coordination of people like Centauri and others in the field that are helping health plans and hospital systems work together. A lot of times they remain still siloed, like Don said, but by using that data in the middle strategy and thinking about it in terms of where do you have similar incentives and how can we create solutions and service offerings that help you both achieve your goals. That's what's really exciting.
Yeah, that's what I loved about the chapter. You identify the problem. We all know the problem, as you stated, and then how to solve it. There's some theory, but then there's also the practical application. Like, you have done it multiple times. And so it's very encouraging. So someone could pick up that chapter and say, oh yeah, I can relate to this problem. Here's a way of addressing it. And wow, there's people that have done this. And I also like the emphasis, all working together, right? And breaking down those silos and working with advisory groups such as your organization and tech enablement for bringing all the parties together and making sure the information flows and things like that to ensure a great member experience as well as patient experience. So
That's
thank
right.
you so much for being part of the book. I really appreciate it. It's going to help a lot of people, and all the royalties, thank you, all the royalties go to cure cancer.
Wonderful.
That's why we do it. We're glad to.
All right, that wraps up another edition of Meet the Authors for Voices of Innovation Payer Edition.